It sounds like something from science fiction, an app that can tell what respiratory illness you have based on the sound of your cough.
King 5's Christine Pei shows us how it works in this week's HealthLink.
Scientists at the University of Washington are now using machine learning to identify different coughs from different illnesses, and one day the tool might be available on your smartphone. Tuberculosis, commonly called TB, is a serious bacterial infection of the lungs and can be dangerous if left untreated. It is less common in the U.S., but the World Health Organization says TB kills 1.5 million people each year, calling it the top infectious killer in the world.
Cough is the most common symptom by far in tuberculosis. So 99% of our patients with tuberculosis had a cough.
David Horn is an associate professor of medicine at UW and a doctor at Harborview's TB control program. He and his team are developing an app designed to compare the sounds of TB-related coughs with other kinds of coughs.
Acid reflux, a viral infection, bacterial pneumonia, asthma, etc. Because you need a group to compare them to.
The team of doctors and computer engineers collected data from a group in Nairobi, Kenya for the research. They compiled recordings of coughs from confirmed TB patients to those who didn't have TB. Take a listen. That is the sound of a TB cough, but compare that to this. That is what a non-TB cough sounds like. Notice any difference?
To your question as to whether I can listen and say, aha, that patient has TB, like a TB Pepsi challenge, absolutely not. Absolutely not.
It may not be obvious to the human ear, even a doctor's, but a machine learning algorithm can.
We converted the audio into a frequency domain and looked at the frequency analysis.
Dr. Manuja Sharma is a UW electrical and computer engineering doctoral student. She and her team analyzed more than 33,000 audio clips of coughs collected from study participants at the Kenya Medical Research Institute in Nairobi. Those audio clips, like these, were then fed into a machine learning program trained to analyze their different frequencies, and they found this.
That passive coughs do seem to have signal that can differentiate between TB and non-TB.
Leading to this hypothesis.
Because of that tissue destruction, the cough sound that's produced could be different than what a cough sound is produced in other respiratory health issues.
The findings are promising. Their research, detailed in the paper Science Advances, found their app on an ordinary smartphone mic predicted active TB coughs at a better rate than expensive microphones. And the team realized such technology could be used as a valuable screening tool.
Meaning you would say, aha, this person has a high likelihood of having TB. Let's send specimens for further studies.
The technology could be groundbreaking in communities like Nairobi, where TB rates are high and where the screening process can be costly. Horn and his team think their cough app can be a solution.
What you really need is something that could be used at point of care, meaning at the bedside, that quickly gives you results, that's low cost, that's simple to operate, that doesn't rely on complex infrastructure or even electricity.
The researchers want to further develop this app to eventually record and compare coughs from COVID, pneumonia, and asthma patients. Scientists are still, of course, developing this technology and researching it. It could take several years before we and physicians can even use it as a screening tool. For HealthLink, I'm Christine Pei.